And time now for our community update this morning.
Joining us today in the studio is Kewaunee County Sheriff Matt Joski. Thanks for joining us this morning.
Well, thank you for having me. This is quite an honor.
How has the coronavirus pandemic affected your department?
You know, in a small agency like ours, while any agency in any community gets impacted, when you have a small staff number like we do, the ramifications, get basically expanded. So we have to be very vigilant, and we have been very vigilant in how to minimize that exposure to our staff, as well as to, being a county jail facility, those inmates, those folks that we also support within that facility.
And so how are you communicating with residents during this time?
You know, this is a great example right here. You know, the relationships that we have with our local media, as well as, of course, the advent of social media, just taking every opportunity that we can to reach out and share messages and try to make them positive messages, messages of what we're doing, the actions we're taking, and how we're trying to keep our community safe.
Now, your staff has gone through crisis intervention team training. What is it and why?
So crisis intervention team training is actually put on by NAMI, which is the National Alliance of Medical Illness, and it really is, I think, key in how we handle those folks that are going through crisis. And so it was a week-long course that our entire staff went through. We were fortunate to get a grant about a decade ago. We used that grant to enhance the collaboration that we have with our Human Services Department, as well as to train each and every law enforcement officer in those intervention skills. And those are huge when it comes to really responding with an appropriate level of care, as well as with a sense of empathy for those individuals that are going through an experiencing mental health crisis.
And so how would you say that training has helped so far?
I think it's helped in allowing us to try to minimize the impact on the system. You know, just like right now we're hearing about the impact on the medical facilities and the systems with this current pandemic. But when we look at mental illness, this has been going on long before this virus, and it's going to be going on long after this virus as it relates to the impact or the resources that are out there to deal with mental health crisis. So whenever we can interact and try to find alternatives, try to utilize de-escalation techniques, it takes that much pressure off of those facilities, which are really a rare commodity in our region.
Can you explain what trauma-informed care is and how you work with the schools to help with out-of-school incidents involving students?
Sure. So trauma-informed care is something it's not new, but I think it's really being embraced more so by a lot of different disciplines, but law enforcement specifically. And a great analogy is when we look at trauma-informed care is approaching an incident or an individual not with the question, what's wrong with you, but with the question, what happened to you? To help understand what brought them to whatever circumstance that they're currently experiencing. So being able to kind of peel away the layers, get behind the scenes, and help understand what brings people to these various crises or these various situations in their lives. And again, that comes back to empathy. But when it relates to our schools, one of the neat programs that we had established a few years back was this increased communication where we're seeing incidents outside the school, but those incidents are having implications to the lives of children potentially in the school the next morning. So really increasing and formalizing the communication between us and school staff to help them understand what a student, what a child may be going through at home, or maybe a crisis call the night before, involving mom or dad or a family member or whatever it is. But being able to connect the dots so that when they see behavior in the school, they understand maybe there's more to it.
So lately, have you been seeing a lot of fraud and scam incidents in your community, and if so, what types? Absolutely.
We've been seeing these again. These have just been historic, unfortunately. And right now, they're situational. You can think about ones that are seasonal. We all think about the seasonal scams, tax season scams, and unfortunately, with this virus, with everything that we're going through, there has been COVID scams. And the elements are the same, though, right? The elements are the same in that what the perpetrators, these potential perpetrators, try to do is elevate your emotion. Now, whether that emotion is fear, joy, anxiety, whatever that emotion is, if they can elevate that emotion, it will then minimize your logic. That's just a simple mathematical equation. And so it could be a lottery scam. That emotion is joy. So they bring up that emotion, which they know is mitigating or minimizing your logic. And that's where people make these rash decisions based on emotion. So our advice is always to take a moment, separate yourself from whatever that phone call, that email, whatever it was, get somebody else involved that's removed from the emotion, and you're probably going to make better decisions. You're going to make a better choice down the road versus acting on that emotion.
And of course, then call your department.
Absolutely.
Okay, thanks for joining us today, Sheriff. We appreciate your time.
Thank you. It's been an honor.